Hi, my name is Angela Rogers, and this is Kinesiology 562 with Dr. Andrew Harbison. The fitness education presentation, this is my critical assignment for this course. Some things we're going to be talking about are the health and movement assessments, periodization, exercise techniques, and how faith can be applied throughout this career and my future career plans. So a couple of the health and movement assessments that I used on my client. The first one is the PAR-Q, which is a screening tool utilized to assess the health and readiness of an individual prior to engaging in physical activity. And the functional movement screen is a pre-screening scored assessment containing 7 individual tests to evaluate weak points in an individual's kinetic chain. So just to give you guys an idea of what they look like, this is the PAR-Q. It's a questionnaire. You just print it out, have your client fill it out, and make sure that their medical history doesn't need to be cleared by a physician or any kind of health risk indications. And the functional movement screen is a tool used by mostly physical therapists, can be used by personal trainers to identify any weak points in an individual's kinetic chain, meaning their basic locomotor stability movements, squatting, lifting legs. The assessment purposely puts these individuals in awkward sort of balancing movements because it brings to light any kind of weak spots that can be improved on in an exercise regimen later. So it identifies what the client really needs to work on during their exercise program. So what my client results came out to be, the PAR-Q showed no health risk indications, no previous injuries. And the functional movement screen was a little difficult for me to conduct because I've never done one before. But what I've seen is that her deep squat needed to be retested on a 2x6 board to show any scapular-thoracic issues. The dowel needed to stay above my client's feet, so therefore she scored a 1. A trunk stability, this assessment showed a lot of spinal muscle weakness in her. Her torso was very wobbly, so it showed that we need to improve her spinal muscles and her back muscles and really get those strengthened. And her rotary stability, I didn't conduct this assessment correctly the first time, so I retested my client, and she scored a 2 with a contralateral movement. I had her do a unilateral movement, which can be very difficult. But overall, she scored a 13, which is average. 14 is usually a great score. So 13 is a really good score for somebody who is a novice in working out, and I'm excited to have her engage in the exercise program. So how does this affect the exercise program that I made for her? Well, the FMS can provide a more accurate prediction of the functional capabilities and performance of an individual's basic locomotor and stability movements. So, because she struggled on the deep squat, I'm obviously going to provide resistance training. So squatting to strengthen her lower body and overall total body mechanics, and push-ups for her upper body and spinal trunk strengthening. So back push-ups are an aerobic type of exercise that can really, really improve the shoulders, the back, the spine. You're using a lot of core, which is one of her goals. So push-ups are just a great basic movement to have her improve on. The amount of external load is going to increase each week. And I threw in some aerobic training because she has goals of weight loss and she wants to improve her aerobic endurance. So her goals are weight loss. She wants to lose 10 pounds, which is a short-term goal for her. And she wants to increase muscular strength as well as particularly core strength. And the type of program I chose for her is an 8-week linear periodization program, considering that she is a novice. She does participate in Pilates, so she is not completely new to health and fitness. However, her body itself is newer to learning how to perform exercises that isolate her weak points. And the type of exercises that I chose are resistance exercises, aerobic, cardiorespiratory, and some plyometrics. So how did I do this? How did I set up my linear periodization for her? I ordered the large muscle groups before the small muscle groups and the multi-joint exercises before single joint exercises. Reason being is because research states when you put them in this order that it avoids fatigue. The frequency, intensity, and duration over both mesocycles are 3 to 5 days per week, minimum of 60% heart rate max intensity, minimum of 30 minutes of cardio per session usually, and 3 to 4 sets anywhere between 8 and 15 reps depending on the week, the mesocycle, and the type of exercise that you're doing, the external load. An example of periodization, a regular day for her would be on leg days. We would start out with a squat. After a warm up, we move on to a deadlift, which are both large muscle group exercises. And then leg extensions, which basically are quad dominant. They isolate the quads particularly. And then walking lunges, which has an aerobic component. So here is what I chose to do in mesocycle 1 and 2 for her exercise periodization. Weeks 1 through 4 is her getting adapted to a new program. So I chose 2 days of resistance training, 1 day of plyometrics, and 1 day of aerobic / high intensity interval training, and 3 days of rest. I chose a percent of heart rate max increasing by 5% each week, just particularly for resistance training, which means I'll probably be increasing her external load, which would use more energy. And 3 by 10 to 12 reps, 3 sets by 10 to 12 reps is the average volume and duration that I use throughout mesocycle 1. It's a basic adaptation. It's a beginning for her. It'll get her adapted to new movements and new exercises. And then eventually we graduate her to mesocycle 2, which is a little bit more intense, a little bit more variations, a few more dynamic movements. I chose 4 days resistance at 75% heart rate max, so her external load would be significantly increased compared to mesocycle 1, week 1. And 1 day plyometric aerobic exercises at 80%, usually because these are including some type of high intensity workouts as well, and 2 days of rest. So her percent heart rate max again is going to be increasing by 5% each week for resistance training. And the average volume and duration is 4 sets by 12 reps and 4 by 8 for strength training. So there's going to be some powerlifting in there, some heavy lifting. And those are going to be 4 sets of about 8 reps. Sometimes there's 4 by 5. So it'll be a little bit of variation in there that she's not used to, but it'll definitely increase her muscle strength as well as core strength. Research states that exercise frequency, duration, and intensity should not increase by more than 10% each week. From mesocycle week 1 to week 4, it might increase up to 15% more, but I did not go more than 15%, no more than 5% per week. Same with mesocycle 2. It starts out about 70%, 75% heart rate max, and goes up to as high as 85%. So we're in guidelines there to keep her safe and keep her healthy. The type of periodization I chose is linear, which is the gradual increase in intensity and frequency of exercise approximately every 2 to 4 weeks. Each week is a linear progression of percent heart rate max, repetitions, and duration of aerobic exercise. So definitely following a linear program here, which I think will be most beneficial. Nonlinear is usually specifically customized down to detail and constant manipulation of volume, intensity. It's very, very tailored to the individual themselves, which would come in handy later down the road when she is looking to compete or looking to power lift or, just anything that really pertains to expert level of fitness. Nonlinear periodization would work, but for her being a beginner, we stuck with linear. The second mesocycle has slight variations of increased load and percent heart rate max with resistance training. So I did manipulate some of the exercises in mesocycle 2, but it's mostly to, produce hypertrophy and to keep her muscles, not used to what they're actually doing. So per her goals, she wants to increase core muscle strength as they recruit larger muscle groups, and in turn, they expend more energy post-exercise as well. So increasing her core strength is one of her big goals, and by incorporating exercises that do that, it'll definitely help her with the weight loss aspect by expending more energy later. Here are my 2 videos. For the compound lower body, I chose barbell squat. For the compound upper body, I chose dumbbell shoulder press. And here, I'm going to go ahead and talk about how the corporate fitness industry can apply to, my spiritual side of myself. I think applying the faith in my future career plans is very important, knowing that I'm very aware of what my strengths and weaknesses are. So I listed them here because I really feel that in order to walk through Christ in your life and to incorporate him in your future and your future plans, that knowing what you're good at and what you're not good at and how to fix them, fix your weaknesses is very, very important. So some of my strengths are retaining information. I love knowledge. I love being able to learn something from people that have, given me a great education. Customer service is a pretty big one because no matter what kind of field you're in, fitness wise, you could be running your own personal training on the side for your friends, or you could be working in a corporate business, like LA Fitness or a gym, and you still have to provide a certain level of customer service because regardless, it is somewhat of a business. So knowing how to speak to people and remembering scripture. I think is very important. Remembering how God speaks to you and how God would want you to speak to others and treat others is very important. So customer service, I feel like, is a strength for me. And having compassion. Again, it comes back to, God has a plan for you, and He wants you to use the knowledge that you have towards others and to better others' lives through compassion and His love. So, um, understanding how to have compassion for others when they want to change their lives is really, really big. Some of my weaknesses through this process, the FMS screen was definitely my most difficult task. I've never conducted one before. So learning how to score the functional movement screen and to actually conduct the entire assessment itself, I learned a lot. So I would definitely have to practice that a little bit and work with a variety of different clients to see if I can recognize any kind of cueing or telltale signs that show weak points. And simple cueing, coaching my clients was difficult because I don't ever do it formally, I suppose. And I was told several times by Dr. Harbison that I tend to give them a lot of cues and a lot to think about when they're trying to perform the exercise. So I'm going to work on simple cueing and practicing my coaching and really researching the correct movement, body movements and exercises and hip extensions and just how the whole kinetic chain and the how the body works essentially when you're exercising. So 3 Bible verses that I want to go over really quick. I am God's workmanship and a new person in Jesus Christ so that I can do good things He planned for me long ago. I love this verse because it absolutely just reiterates everything I've always loved about God. He will always have a plan for your life. And for my future, if I can take the knowledge that I've been given and blessed with by Him, I can use that to change somebody's life. If somebody comes to you because they want to physically and mentally be a better person, it's a blessing and it's just a great gift from God to be a part of that in someone's life. So He'd always planned that for me long ago. All scripture is inspired by God and is useful to teach us what is true and to make us realize what is wrong in our lives. It corrects us when we are wrong and teaches us to do what is right. God uses it to prepare and equip His people to do every good work. This basically is just talking about how scripture is always going to be the foundation of how you walk through your life with God. Scripture is always a message for me. And again, it comes down to having compassion and doing every good work. I want to do everything through God. I want to do all good things through God. And being in this field, having a future that changes people's lives and brings them a whole new healthy outlook on how to appreciate their bodies is doing good work. And remembering scripture and remembering that I am blessed with the knowledge and the gift of and the passion of having to do work like this for Him and change people's lives through fitness and health. I just think it's a beautiful, beautiful scripture. A cheerful heart does good like medicine, but a broken spirit makes one sick. This is my favorite verse. A cheerful heart does good like medicine, meaning that your positivity and your bringing somebody up, uplifting. Having a cheerful heart can sometimes do more than just what some good drugs can do to heal you. So having a broken spirit makes one sick. So bringing people down, in the future in a corporate setting, there's a lot of people that can judge, a 300-pound person for coming in and striving to be a better person when the first time they walk through the gym. But instead of being that broken spirit, be the cheerful heart that, speaks to them the way that God would want you to speak to them. And just letting them know that you are rooting for them and that you are here for them if they need you. And you are so proud at the fact that they are strong enough to want to change their lives. So I really hope that you guys enjoyed this presentation. It's been really great to learn everything through this course, and I hope you enjoyed it.